Your body has a rhythm. You might not think about it, but it's there. How often you go to the bathroom, what your stool looks like, how it feels. For most of your life, that rhythm stays consistent. It's your baseline. And then one day, something changes. Maybe you're going more often, or less often. Maybe your stool looks different, feels different. Maybe you're straining when you never used to, or you feel like you can never fully empty. And here's what most people do. They wait. They assume it's temporary, something they ate, stress, a bug going around. They give it a few days, maybe a week, and sometimes they're right. It resolves. Life goes back to normal. But sometimes it doesn't. And this is where the problem starts. Because when a change in your bowel habits persists long enough, your brain recalibrates. This new pattern becomes your new normal. And you stop noticing that anything changed at all. If you've ever thought, I guess this is just how things are now, this video is for you. Let me show you what your body is actually trying to tell you. When your bowel habits change, the type of change matters. There's diarrhea, going more often, looser stools, urgency, that feeling like you need to find a bathroom right now. In most cases, diarrhea is temporary. Food poisoning, a stomach bug, something your system is clearing out. But when diarrhea persists for weeks, when it doesn't resolve, that's a different signal. Because your body isn't supposed to stay in that state. Then there's constipation, going less often, harder stools, straining, that backed up feeling. Again, constipation happens. Dehydration, low fiber, travel, medication side effects. But new constipation that doesn't improve, constipation that becomes your baseline when you used to be regular, that's worth paying attention to. Then there's a change in stool caliber. Your stool becomes narrower, thinner. Some people describe it as pencil thin or ribbon-like. This one is specific, because narrowing suggests something is affecting how stool moves through your colon or rectum. And that pattern shows up repeatedly in lists of colorectal cancer symptoms. And then there's incomplete emptying. You go to the bathroom, you finish, but you still feel like you need to go. That lingering urge that never quite goes away. This is one of those symptoms people don't talk about, because it's uncomfortable, vague, hard to describe. But it's also one of the most commonly reported symptoms in people who are eventually diagnosed with colorectal cancer. These aren't all the same thing. They're different messages, and your body is using them to tell you where something might be going wrong. But here's the part most people miss. It's not just about the change itself, it's about what else is happening alongside it. Because a change in bowel habits on its own usually isn't alarming. Most of the time it's benign, temporary, explainable. But when that change comes with other signals, the story shifts. Let's talk about clustering. Change in bowel habits plus blood. That combination shows up again and again in clinical symptom lists for colorectal cancer. Bright red blood, dark blood, black tarry stool. Any of those, paired with a persistent change in how often you're going or what your stool looks like, moves you out of the wait and see category. Change in bowel habits plus abdominal pain. Not sharp, fleeting pain, but ongoing cramping or discomfort that doesn't quit. When researchers looked at younger people diagnosed with colorectal cancer, people under 50, the two most common symptoms they had before diagnosis were blood in their stool and abdominal pain. And about 1 in 4 also had altered bowel habits. Not dramatic symptoms, not emergency room level distress, just persistent, quiet changes that got dismissed for months. Change in bowel habits plus unexplained weight loss. You're not trying to lose weight. You're eating normally, maybe even eating more, but the number on the scale keeps dropping. That pattern, bowel changes plus weight loss, is one of the red flags that clinical guidelines specifically call out. Change in bowel habits plus fatigue. Ongoing exhaustion that doesn't match your activity level. Weakness that feels disproportionate. Sometimes that fatigue is connected to anemia, because colorectal cancer can bleed slowly, invisibly. You don't see the blood, but over time, that slow bleeding depletes your iron. Your red blood cells drop, and you feel drained, and you think it's stress, or poor sleep, or just getting older. Meanwhile, your body has been telling you something for months. Here's why this matters so much. Bowel habit changes are common. Everyone experiences them at some point. Diet changes, a stressful week, a medication adjustment. And because they're common, they're easy to dismiss, even by doctors. Your doctor hears about bowel changes all the time. Most of those patients have something benign, IBS, a dietary trigger, a short-lived infection. So unless you walk in and say, "My bowel habits changed 3 months ago, I've lost 10 pounds, I'm exhausted, and I've seen blood twice," it's very easy for the bigger pattern to get missed. Because you're reporting it piece by piece, symptom by symptom, and nobody steps back to see the whole picture. This is exactly what happens with early-onset colorectal cancer. People in their 30s and 40s don't think cancer. They think stress, bad digestion, hemorrhoids. And their doctors often think the same thing. Because colorectal cancer in younger people used to be rare. But it's not rare anymore. The rates are rising. And by the time someone finally gets the right test, months have passed. Not because anyone was negligent, but because the symptoms whisper. They don't shout. And in healthcare systems around the world, there are now structured pathways to catch these patterns earlier. In some countries, if you're an adult with a change in bowel habits, especially paired with other features like rectal bleeding or anemia, you may be offered a specific test called AFIT test, fecal immunochemical test. It detects hidden blood in stool. That test result, combined with your symptoms and age, helps determine whether you need further investigation. These pathways exist because clinicians realized that waiting for dramatic symptoms was costing time. And time, with colorectal cancer, matters. Here's what I want you to take from this. A change in your bowel habits is not something you need to panic about. Most of the time, it resolves on its own. Most of the time, it's nothing serious. But it is something you need to notice, and track, and report accurately. Not because every change means cancer, it doesn't, but because the pattern tells a story, and you're the only one who knows the full timeline. When did this start? Weeks ago? Months ago? Has it gotten worse? Stayed the same? Come and gone? Is it alone? Or is it paired with blood, with pain, with weight loss, with fatigue? Have you adapted to it? Has this new rhythm become so normal that you've stopped thinking about it? Those details matter, and they matter more than most people realize. Colorectal cancer is one of the most preventable cancers when caught early. Screening works. Early detection works. But screening only works if people show up. And people only show up if they recognize the signals their body is sending. You don't have to diagnose yourself. You don't have to panic. You don't have to assume the worst. But you do have to pay attention. You have to notice when your baseline changes. And you have to give clinicians the full picture so they can see what you've been living with. Because your bowel habits aren't random. They're part of a rhythm your body has maintained for years. And when that rhythm changes, persistently, your body is speaking. The question is whether you're listening. If this kind of content helps you understand what your body is telling you, subscribe and hit the like button. We're building a community that doesn't ignore the signals.